So PRP stands for platelet-rich plasma, and it's a relatively new concept in orthopedics, and it's really been a game changer in orthopedic surgery and musculoskeletal health because it's given us an option to treat a lot of conditions that really didn't have a good treatment. So a lot of people get confused. They think that PRP is stem cells, and it's often referred to stem cells. But what it actually is platelet-rich plasma, meaning we take your blood, just like you would go into the lab, get a blood draw, put it in a centrifuge, spin it down, and then get all the concentrated good cells. So maybe out of 60 cc's of blood, we only get 5 cc's of great concentrated cells, and then we're able to inject those cells back into your body to induce a healing response. PRP has been really good for chronic conditions or acute tendinopathies. And so anytime a tendinopathy or tendinitis is any type of inflammation that develops within a tendon, this can occur in the elbow, this can occur in the knee, and it's been a really good therapeutic treatment to induce healing responses that your body otherwise would not be able to do. And again, that's something that we haven't had in the past, and this is all relatively new to the field of orthopedics. We're still learning what the best treatments are or what the best conditions are to treat with PRP. And it's an exciting time because there's a lot of research and development going into PRP. So PRP has also been used to treat early and mild arthritis. And this is an exciting field because you may have patients who are not ready for, say, knee replacement, but may not be a good candidate for any type of arthroscopic surgery. And so they're in what we call the gray zone, where they really don't have a good surgical option, but yet they're wanting to get pain relief and they're wanting to stay active and have as much function out of their knee as possible. And PRP has been shown through multiple studies to be advantageous. I think it's a little too soon to say that it regrows cartilage, but it has been advantageous in pain relief, and best case scenario, what we're hoping is that it stalls or slows the progression of cartilage loss, which then of course leads to arthritis. So early on when PRP was just getting going, I had a good friend who was trying to help his son out as a baseball pitcher, and so he was doing a lot of squatting and ended up really getting a bad tendinitis in his patellar tendon. And we would never consider steroid injections in the patellar tendon for fear of rupture. And so I told him about PRP. I said, hey, I think this is an option. I can't guarantee it, but it's a safe option. And we injected his tendon, and within 3 to 6 weeks, he was back to doing anything he wanted to do. Really would have gone on to do months and months of physical therapy and may not have ever even gotten the response that he got from the PRP. I think one thing that we need to be cautious of, though, is PRP does not treat everything. And so there's a lot of people who think of this as a magic bullet or stem cells that can treat everything. And so you need to look at the literature, talk to a doctor who understands what PRP is, how it can be used, and see if it's right for you.